Flu is a disease that makes people sick when you get right down to it. It's a virus. It's something that is easily transmissible from one person to another, and it generally gives people fever, makes them feel lousy all over, and typically in an otherwise healthy individual will make them sick for maybe 3 to 5 days if they're lucky. It might hang on for a week.
It really is a fairly severe illness, and people who've really had influenza with the cough, the muscle aches, the fever, the feeling terrible, know they've had influenza. So it comes on suddenly. It has a lot of symptoms associated with it. People have a hacking cough, sore throat, runny nose. Sometimes they can get pneumonia from it. They can get so severely ill that they can wind up in a hospital intensive care unit. And every year, about 36,000 people who would not have died otherwise die from just ordinary influenza.
Seasonal flu is the flu that comes every fall and starts usually in October or November, goes through February or so, and then disappears.
We are hit every year with the flu, just as any other school is. We have students that will get sick at a moment's notice. We send them home, have high fevers, there's vomiting, there are a lot of sneezing, a lot of coughing, and that's something that certainly impacts upon every school district.
We're particularly concerned about our children who have chronic illnesses and diseases. We're particularly concerned about our older teachers. We're particularly concerned about our young children in preschool because the mortality rates among those groups are much higher when they contract flu.
The strain of flu that is around one season will not necessarily be around the next season.
Most organisms are spread either two methods, droplet or hand-to-hand. Droplet being when we cough and sneeze and it blows in the air and then it enters someone else's respiratory system and they can become infected that way. Or hand-to-hand, whereas we touch those secretions and then touch a part of our body that the organism can enter through, such as an eye, a mouth, a nose, or some mucous membrane that the organism can then transmit through the body with. But either way, if the hands are clean and if we are able to stop the spread through the places that the organisms can move through in the most efficient way, then that's where hand washing stops that cycle of spread. If you think about a school setting, which we all do in school nursing, that means that a student with a cold in a classroom who does not cover their nose or mouth is then spreading through the air their cough and cold. So obviously cover your cough and covering sneezes and always using a tissue is the first line of defense for an airborne illness. But the second line is always washing their hands after they blow their nose. And clearly, in a school setting, it's quite disruptive to have a student get up every time to wash their hands. But the good news is that we now have the gel sanitizers, hand sanitizers, which are effective to keep the classroom decorum intact and yet send the message that it's not okay to blow your nose and then not wash your hands. So I think that, it's the hands that touch everything that spread the germs that make us ill. The proper way to hand wash is to wash for at least 20 to 30 seconds under warm soapy water, touching all of the surfaces of the hand and the nails and the wrists, rinsing thoroughly and then shutting off the water with the paper towel that you're using to dry your hands. If you then shut off the dirty faucet with your nice clean hands, voila, you have now reinfected your hands that you just washed. So if we teach children who do not have the availability of the pedal-operated sinks in their schools to make sure that they're shutting off the running water with a paper towel rather than their nice clean hands, then once again we break that cycle of spreading organisms through things that we touch.
First of all, universal precautions, also called standard precautions. It's something that we do for all cases to prevent the spread of diseases like HIV, which is a bloodborne disease, as well as cold and flu viruses that can cause infection. And what those standard precautions involve are very, very simple. when you're in the contact of any blood or body fluids, if you're, say, a caregiver that's responsible for, say, caring for a nosebleed, or if you're responsible for cleaning a diaper, that you should wear gloves. Custodians, especially where they're responsible for cleaning up after messes like blood spills, food messes, urine and feces, accidents, should pay particular attention to universal precautions and wearing gloves when they're doing cleaning, as should food handlers that are in the business of preparing food and washing their hands before preparing food as well as after. Bus monitors, they have a unique role in transporting our children, and children are coming to school with more and more illnesses and chronic diseases, and those children have special needs as well. So bus monitors should be vigilant to universal precautions as well. If a child vomits on the bus or has an accident or is bleeding, they should too adhere to wearing gloves for cleanup of any spills or any accidents, and any IAs that are working with children that are having any issues should adhere to those as well.
We basically talk a lot about hygiene, about washing your hands on a regular basis. If you sneeze, if you use a Kleenex to wash your hands, and those are some of the universal precautions that we strongly recommend to anyone.